Peace and welcome to our special community conversation tonight with Baltimore City Public Schools. I'm your host, Faraji Muhammad. Tonight, folks, we're going to have a very, very important conversation, a conversation about the big decision of the reopening of schools. It's a special, important, timely conversation to have this discussion. And tonight, we're going to talk about this from a lot of different viewpoints. But this conversation is important for a couple of reasons. One being, we're going to be talking to one of the big decision makers herself, Dr. Sonja Santelises, who serves as the CEO of Baltimore City Public Schools. But also, we will be talking to a few other voices to give us a full picture of what will be happening, how should parents and teachers prepare, and most importantly, what will be the support for the students. Now, bringing us to the second reason why this discussion is so important, the students. Throughout this whole educational change and paradigm shift of learning and teaching, we have been hearing from many people, administrators, teachers, political leaders, medical experts, and community members. But we have not heard from the unheard, the students. And so tonight, that's why we are having this discussion, because we are asking that every one of you, parents, grandparents, aunts and uncles and caretakers, those that have students in the Baltimore City Public School District system, we encourage you to have them to participate in this conversation. We'll give them the time, we'll give them the space, most certainly, and most importantly, our attention as we have this important conversation about interest, health, and safety. Tonight, I'm so happy to have joining us for the first part of this conversation, Dr. Tolu Onigbanjo, who is the assistant professor at the University of Maryland, and also she is a pediatrician for the University of Maryland system. Also, we have on the line Ms. Ketia Stokes, who is the director for the wholeness of students for the Baltimore City Public School System, as well as a mental health professional. Dr. Tolu, Ketia, thank you so much for joining us this evening.
Thank you for having us this evening.
Absolutely, absolutely. Let's start off with you, Doc, because this COVID-19 situation has been about the medicine and has been about, what COVID-19 is and all of the details of it. Many people are saying, look, we're following the science, we're following our health professionals. And here on this platform, we've been talking to numerous doctors, particularly Black doctors, because we want to know for sure, we want to know without any type of doubt, with great certainty about what we're dealing with right now. What are the key metrics that were used to determine the returning to school was a safe choice and a safe option for our students?
So I think the big first step is where our positivity rate is as a nation, as a state, as a local official. It helps kind of guide, what level of protection we need to have in place to ensure that our kids, our teachers are safe. I think one of the things we have shown is that masks do work, and that if they're implemented correctly, they're a great way to help decrease, exposure and infection of our youth as well as our teachers. I think the converse and the challenge that we see every day is how learning has been challenged for our students in different ways. I have patients who do well with virtual learning and remote learning, and others who are really struggling. And we have to really understand that the decision should be based on the family, the individual, as well as the youth. It's not going to be a perfect solution for everyone, but it's going to be a solution that's going to be important that we make, thinking of the youth specifically and what works best for them.
And that leads me to my second part of the question, Dr. Tolu, which is the fact that, some people are saying, well, this is not in the best interest of young people. This decision does not work. Considering that there have been a number of stories and cases where students have gone back to school, and you know, here in the state of Maryland, Carroll County, and some other places around the country, they reopen schools, an outbreak has occurred, and then, you know, not only is that one person, it's teachers, it's staff members, it's administrators, it's other students. So for a situation like this, I mean, we're talking about a system of 80,000 plus students. You know, how can you give some peace of mind, some assurance, if you could, to parents and to community members and just to the city of Baltimore about how this is going to be done, and that this process is going to be done safely?
That's a great question. And I think the first step to take a step back is that it's an individualized decision, right? And that there are kids who are not in school who are really suffering and having a hard time adjusting. And that when kids do go back, we know that in certain environments where kids do go back, the infectivity rate in the school is very much different than the community, right? So of course there is a risk, and it's a balance between the benefits and the risk, right? And that we have kids who are really struggling with their ability to learn. The virtual platform doesn't work well for them. They're struggling emotionally and socially from being isolated from their learning environment, while we have others who are excelling and doing well. I think the areas where it's been shown is that when you take appropriate mitigations, staying 6 feet apart if possible, wearing a mask, the rate of infectivity is much lower. And so it's balancing the risk and benefit.
And I feel like that is the place that we find ourselves in a lot of different spaces, not just in schools, that it's a balancing act, you know, even in the workplace. There are some, you know, faith institutions, you know, houses of worship that are open, and there's that balancing act. So I feel like that is the big thing. I think that for a number of people, some people would say it's children. This is you know, this is a balancing act where children are most affected. Talk to us about the idea of children being exposed on this, doc. What at the science, the data, the research said about small children being exposed to this virus? Because this school reopening is going to be a staggered plan. You're going to have your youngest to the oldest over these next couple of weeks. So give us some insight about that, please.
So what we do know is the level of transmission can vary based on the age of the child. It doesn't mean that we're in a state of life where we're pre-COVID, where there's no COVID that exists, right? But the rate of transmission and how well the virus is spewed in the environment can vary based on how protected the child is. So if they're wearing a mask, how much those particles will spread. We do know that, you know, if you are in close contact without that mitigation, without a mask, your risk of exposure and potentially being infected is there. But when those things are taken into account, the possibility decreases significantly, and that, you know, the rate of transmission may not be as high as being in your home environment who has with someone with COVID without a mask and being in close quarters.
Absolutely. Absolutely. Folks, we want to hear from you. And this is the opportunity where the adults, we would definitely love to hear from you. You can join us in a conversation right now at 410-319-8888, 410-319-8888. Let's bring Ketia Stokes into this conversation. Ketia, you're dealing with mental health, you're dealing with wellness. This is a major shift for some students. How can we make the transition less jarring to not create any mental or emotional disruptions?
Yes, excellent question. And I do want to kind of clarify before I jump into that, because I don't want to misrepresent. I know many of my mental health colleagues have gone through numerous years of learning and experiences. So I am an educator by trade, not a mental health professional. So I just wanted to clarify that for any of my folks out there who might be listening.
We appreciate that. We appreciate that.
But you're absolutely right, just in terms of the importance of making sure that our students are cared for socially and emotionally in terms of their well-being. In terms of what we're doing here in city schools, we really have two legs of that. We do have our work around student wholeness, which really focuses on social emotional learning. And then we do have our work around mental health. So I'll spend a few minutes, if it's okay, kind of differentiating between the two and sharing what we're doing there on both legs of the work. So when we're talking about social emotional learning, we're talking about all the skills and things that we are doing daily, every day. This is as youth and as adults. So we think about them in 5 larger terms. We have self-awareness, self-management, social awareness, relationship skills, and decision-making skills, right? Some people probably say, yep, that was a lot of words. What is it? I like to boil it down to social emotional learning is who I am, how I show up, what I do, how I manage, how I interact. So when you think about that, social emotional learning is really about experiencing, managing, and expressing our emotion, right? Being able to manage changes in healthy ways, being comfortable with who we are and what we value as being as important, being able to maintain motivation and self-discipline. So we're talking about that self-management piece, but also making good decisions. So when we're thinking about in COVID, making sure that we're making decisions that are keeping ourselves safe and keeping others safe. And being able to empathize and develop relationships with others. So those are skill sets that we are really utilizing every day. When you think about that now in terms of the pandemic, you see that really impacting our young people in terms of being able to just manage and cope with all the different changes and isolation. You see it and hear it from our youth in terms of balancing the responsibilities of home and school. So now there's no separation between home and school. Home and school is happening all in that same space. So being able to balance, hey, I'm trying to listen to this lesson, but I also need to take out the trash. And maybe I have my younger siblings who are here with me. And so really trying to balance all of those responsibilities. But you also hear it or see it and experience in some of the fear and the anxiety that may show up just in terms of all of the changes, right? And then just coping with the loss, whether it's loss of what we have known before, the loss of the regular traditions around schools, whether it's prom or just being able to experience extracurricular activities, but even also the grief and loss that comes with loved ones that we may have lost on this time. So when we are thinking about that social emotional space there, we're really focusing on making sure for our students and their well-being, we're tapping into opportunities for our youth to be able to really discuss and talk about the impact, talk about their emotions, talk about their feelings. And one really key important part here is really making sure that we're giving opportunities for our youth to really connect with others and build that relationships and really go back to, even in this space of isolation, even though we might be physically distant, we really know how important it is, connection is. And so really emphasizing the relationships and the connection, even in this virtual space.
Absolutely. I appreciate you laying that out for us, because there are so many components of health and well-being and wholeness that I think that in every institution has their own definition. And so I'm so happy that you were able to lay that out for us. Folks, you can join us in the conversation as I'm speaking to Dr. Tolu, who serves as the director of pediatrics for the University of Maryland. We're speaking to Ms. Ketia Stokes, who is the director for student wholeness for Baltimore City Public Schools. 410-319-8888, 410-319-8888 to let us know your questions, take your calls about this important part of the big decision of reopening the schools. Ketia, kind of going back to you, what has been the feedback that you received? Do parents and students want to return to the classroom at this point? Are they pretty solid? Because it seems like, depending on who you talk to, if you talk to, you might talk to one team and say, no, we're not, everybody's against it. But then I've talked to some students who say, I'm ready to go. I've talked to some parents that said, I'm ready to go. So what's been the feedback that you received?
Yeah, you know what? It's really mixed, right? And rightfully so, because going back to the beginning piece of this is an individual decision. And this is something that isn't easy, right? And so where we do have some students who find the virtual space to be that sweet spot, right? I am in a space where I might be able to concentrate better, right? I might find myself in a space where if I'm a student that struggles with the social piece of things, really connecting with others, being at home learning virtually might be that sweet spot for me. So I may want to continue there, right? But then we also know that we have some of our young people where their home situations may not necessarily be the best in terms of wanting to show their home on camera, or at times maybe there's a lot of things happening in the background, and so they're not able to really focus. So being able to be in the schools and have that opportunity to focus is really, yep, I want to be there. I need to get back in. I'm that person. I need that touch point with that teacher and that adult. And here's the one thing that, you know, school really offers that we oftentimes, I think sometimes underplay. It is just that beauty of connecting with others, right?
Right.
So if you reflect
Right.
back on your time in school, it, you know, everyone can think about that one or two teachers, or maybe the one or two cafeteria workers, or maybe that assistant principal, or it might have been that coach. You have someone who is that adult that you really connect with, that really motivates you. And so for some of our students, they're really missing that piece. Right? I'm missing that connection piece. I'm missing that person that I find to be that trusted adult. I am missing that opportunity to just really get that one-on-one, whether it's academic support that I need. And let's not forget, we all love to socialize and engage with others, right? So
Right.
even that part of just being around others is often missing. So I think it's balanced, and it really is dependent upon what the families need, what the individual student needs. And what I'm hearing from the youth is, you know, I'm hearing that some youth are, I'm worried about my grades. You know, if I look back on my grades a year or two ago, I had a 3.4, I had a 3.0, right? And so they're struggling now, and they really want to get back to a space where they could show up and be their best selves. And that is that connection to that wholeness. And so I think about what we're offering is that space. Again, going back to wholeness, being able to show up as your best self and be. So for those who can excel in that virtual space, that virtual option is still there. But for those who really feel like I need to get back in it, in the groove, I need the routine, I need the feel of the building, I need that essence, then that option is there for them as well.
Dr. Tolu, when we're talking about this whole process, especially now that we're in the stage of vaccinations, you know, the city and the state has stepped up its efforts to try to get more people vaccinated. The first question is, should students get tested? I know there aren't any vaccinations for students, but should they get tested prior to returning to school, or at least within the first couple of weeks of going back to school?
That's a really great question. I think every institution, every school, every locale can help guide what is the best approach, whether they should get tested before they go back to school. I think of a test, honestly, as a time point that is going to change. Your exposure can be different minutes after you get tested, right? So it gives you helpful information if somebody is positive and they need to stay out of school. But, you know, I always think of a test as only as good as what you're doing right after you're tested, right? So it's really a combination of really monitoring for symptoms that may be worrisome, exposures that may be worrisome. And I think we all need to kind of continue to keep our guards up to ensure that if you're not feeling well, it's okay to say, this is just not the day for me to go in. Of course, a test may help, but I don't think it's an end all or a solution to ensure that it's quite safe to go back. We do know people can get tested and this very moment be negative, but may test positive later on, right? So it's not the perfect test, right? So it's really important to monitor what you're exposed to. And if you're having symptoms that makes you worry, seek out your care provider, seek out your doctor, seek out your pediatrician to help figure it out, and don't feel isolated trying to figure it out by yourself.
Yeah, because I mean, I would think that, I had a conversation, and some people are still in the space of not being tested, and some people are, you know, have been tested numerous times. Mike, one of my concerns on this, doc, around this is that, you know, even with teachers being tested or vaccinated, there are some students who have been exposed, that there are a number of teachers who aren't excited about returning. If the student has it in his or her mind that the teacher doesn't want to be there because the teacher is not tested, or the vaccination, or has not been vaccinated, then that would become another impediment for the classroom. So how should that be handled if you know you go back into the classroom, you're like, okay, I'm here, and then your teacher's like, well, I haven't even been tested, and blah blah blah, and I don't even know. I don't know why I'm here. I mean, it seems like it can create another level of stress in the classroom.
Yeah, I mean, I think we need to, I always think about everything that we do. We have to think about who's at the center of the issue, right? And who's at the center of who we care for. And so I can be a physician today and not bring my baggage behind me, right? Because I know I'm stressed for whatever reason, but I need to focus. And I think we all agree that the students are always our number one priority. And so it's really important that even if we are all struggling with a decision that is a hard decision to make, that we ensure that whatever positivity we put forward is something that's meaningful for the growth of the student. But the best way to kind of confront that issue is we know that even if you're exposed to someone, if you're taking the appropriate mitigation, such as a mask in place, that your risk is much less. I think we've been living in this COVID-19 pandemic for almost a year, and where we were March of last year is very different. We do know a lot more. I think to some degree, we probably have been exposed to someone with COVID, but we're wearing our mask, and that risk of exposing your nose or your mouth or taking in that virus goes significantly lower. So if we're taking all the mitigations, even if you're potentially exposed to someone, your risk of probably developing infection, if you're taking appropriate mitigations, would be much less.
Absolutely. So, let me go get a couple of calls, and we got Doreen on the line. Doreen, thank you for checking in. What's your question or your comment? We got Doreen on the line?
Yes.
Yep, Doreen?
Hello?
Yes.
Doreen, can you hear me?
Yes, ma'am.
Yes. My question is, so my granddaughter's going from 5th grade to 6th grade next year. I have to take her to her pediatrician because she cannot get in school unless all her shots are up to date. And I guess my question is, if we're in an active pandemic and we're still required to have all shots updated from before, the polio, measles, mumps, etc., why is it imperative that these kids be vaccinated? I haven't talked to a teacher that doesn't want to be in class. I've talked to plenty of teachers that are worried about their safety and the safety of their families and the children. And I don't understand the urgency, because what I hear from my children's teacher is that we're working 24/7 to get the virtual thing right, where we can help all kids. All kids are not helped all the time anyway. There's always some children dropping through the loopholes who are depressed, who are socially. My granddaughter thinks she's going to show up at school, go and visit all of her old teachers, hug all of her friends that she hasn't seen in a while. That socialization that she is just yearning for, she's going to be surprised because she's not going to get that either, because in order to stay safe. And my last question is, a lot of what I see on television are people talking about the issues, but they're still at home. They're not in their offices. Parents who are sending kids back to school are still working from home. So it's not safe for them to go in their offices, but we have children and teachers who, my daughter was a teacher, who are already stressed from maintaining a classroom pre-COVID. I can't imagine trying to teach homeschool and keep children with masks on and at a safe distance, and you have adults by the dozens. My husband still works from home that can't go into their office because they're not deemed to be able to work safely.
All right, Doreen, we appreciate that. And I feel like those are two questions for each one of you. So Dr. Tolu, I'll start with you, and then Ketia, we'll get your thoughts. And thank you, Doreen, for checking in.
Yeah, I think it is a really difficult, challenging issue on so many different levels. I mean, I think every player in place obviously has like the best interests of the students at heart. And, being a physician and having to come to work every day and not be that person who can work from home, I think I've had my reservations and my fears. But having had to do it for the last year, I think there is a way to do it safely. And I think, even our access to vaccine just happened recently. I think, of course, in an ideal world, it would be nice to wait until everyone is vaccinated, but we know that it's really challenging and it's not a decision that could be made for everyone. That the hard part is there are people who are really suffering at the moment and who are being, further being pushed behind because they're really suffering by not being in the learning environment. So of course there are clear challenges and very difficult challenges to achieve, but having done this for the last year, I think, and having to actually go into work, there's a true fear, but I think if all the mitigations that we've taken in place has kept myself safe and my patients safe, and I'm hoping that same mitigation when it's taken in the school setting will help make the difference. But once again, it's a decision that should not be made lightly. And of course, in an ideal world, everyone would be vaccinated, protected. But we know that that journey to get to that point is further away than we would hope.
Absolutely. Ketia?
Yeah, absolutely. And I appreciate the parent for sharing their sentiments. I will share that I will leave the vaccination question to the doctor here because I think that's more of her area there. In terms of the school policy side, in terms of vaccinations, I don't know the depth of that information. I'm sure Dr. S and Chief Hike-Hubbard or those coming behind us could probably answer to that a little more. But I think just the point around making sure that we are doing all to make sure that our schools are safe. And that our offices are safe. I think there's a sort of like a staggered process. So it's sort of the same staggered process in bringing smaller groups of students back to school and staff back to school. It's sort of that same staggered process that's taking place with staff, whether it's in other offices or district offices. We do have staff that are returning to school because it's important that we are also showing up in that same way, that we are not asking for our students or our teachers to do what we're not willing and able to do as well. But we also want to make sure that we're being conscientious about being safe in that process as well. So just as we have small groups for the schools, we also have the small groups for staff to return back to offices as well.
Fantastic. I want to thank both of you for your time tonight and giving us some insight into the decision-making to reopen schools. Dr. Tolu Onigbanjo serves as the medical director for the University of Maryland Pediatrics at Midtown and also is the University of Maryland assistant professor at the Department of Pediatrics. Thank you so much, Dr. Tolu. And Ketia Stokes serves as the director for student wholeness for Baltimore City Public Schools. Folks, we're going to take a quick pause. When we come back, we'll have more conversation. We want to hear from young people about their questions and concerns because we'll be joined by the CEO herself, Dr. Sonja Santelises, along with the Chief of Communications, Engagement, and Enrollment, Mrs. Tina Hike-Hubbard. So stay riding with us. A whole lot is coming up for this special conversation about the reopening of public schools here in Baltimore. We'll be right back.
We'll return to our community conversation after these messages.
Probably.
Now?
Yeah, it's 5:35.
Okay.
Okay. Good evening, Dr. Santelises. How are you, ma'am?
Presents
I'm
a
fine,
special
sir. How you
community
doing?
conversation
I'm
with
good.
host Faraji Muhammad.
Mrs. Tina, how are you?
I'm good, Faraji. Good to see you. How you doing?
I'm good. I'm good. All
Thank
right.
you for having us on. We really appreciate it.
Oh, absolutely. Thank you for the opportunity. We definitely needed to have this conversation. And welcome back to our special community conversation, the reopening of Baltimore City Public Schools. I'm your host, Faraji Muhammad. Folks, we are having this conversation because on Monday, March the 1st, begins the first phase of bringing students back for in-person instructions. And we just talked to Dr. Tolu Onigbanjo and Ketia Stokes to give us some insight about what we can expect and which are some of the big pieces of why this big decision was made. Well, now it's time for us to talk to the big decision maker herself. We are joined by the CEO of Baltimore City Public Schools, Dr. Sonja Santelises, along with Mrs. Tina Hike-Hubbard, who serves as the Chief of Communication, Engagement, and Enrollment for Baltimore City Public Schools. Now, folks, as we're having this conversation, I want to encourage you, and most importantly, encourage the young people that are near you, your children, your grandchildren, your niece and your nephews, to be a part of this conversation. We are opening the lines right now at 410-319-8888, 410-319-8888, to be a part of this discussion where you can have a one-on-one talk with the superintendent, the CEO of schools herself, and to learn, to listen, and to understand. And folks, no question is off the table. There's no, I was told back in the day, there's no such thing as a stupid question, especially when it comes from our students. We want to make sure that the students' concerns and their interests are clear and are understood. And that's why we're having this conversation. So again, for all of my teenagers listening in, to all of the 10-year-olds listening in, now is the time to join us at 410-319-8888. Let us shift gears. I'm going to start this conversation with Mrs. Tina Hike-Hubbard. Then we're going to go to Dr. Santelises to talk about some of the bigger issues. But Tina, thank you again for being with us this evening. We truly appreciate it.
Thank you for having me. I'm happy to be here.
Absolutely. Let's talk about this process, because this is pretty much re-engaging 80,000 plus students back into society, for lack of a better word, right? You're talking about transportation, you're talking about children back on the streets, right? Over these next couple of weeks. And I want to emphasize that this is a staggered, phased in program. This is not like on Monday, folks, everybody just like the running of the bulls. It's not happening that way. It is a staggered process. But talk to us about this staggered process, because I know it just starts with the smaller children and then works its way up to the older children.
Yep, happy to do so. So on Monday, March 1st, as you said, we have our kindergarten through second grade students who are coming back in person. Now, it's not all kindergarten students or K through 2 students, because families have a choice. They can decide whether or not to send their students back, but for that first 2-week period, those kids will come back. Then on March 15th, we are inviting our 3rd through 5th grade students to come back as well. And then our 9th grade students will be going to high school as well, again, by family choice. And then right after spring break on April 12th, we're inviting our seniors, our 12th graders. It's the start of the 4th quarter, and we're inviting our 12th graders to come back at that time.
Okay, so it sounds like there's going to be a better sense of management. Is that what I'm hearing?
Well, we've had a series of openings already where schools have been in person, right? And we know that to do this well, we have to have small groups of students, socially distanced with all the safety protocols that the CDC recommends, right? So when we do that, we're doing it slow to go fast, meaning we make sure we have the right amount of students in the classroom, that we're managing the processes carefully. We have our pathways through schools, the kids know when to come in, which way to go out, and we know how to do this well and do it right. So we do this first with our smaller group of students, and then in March, we'll come back and think about how do we add other grade levels? I've heard lots of kids and families tell me, what about 8th graders, right? What about 10th grade? We want to come back too, and we want to honor that. So in March, we'll come back and share how we're able to then expand once we do this first opening really well.
Now, Tina, talk to us about, the setup for this, because there has been a number of people that have called into this show and on this platform, and they are concerned that third graders and the smaller children won't be able to adhere to those safety protocols, keeping their mask on, following, being socially distanced. Give me some insight as to how is that going to be ensured in the school system, in the various schools.
Yep. So all fall, we have actually had students in person. We started with summer school with about 200 kids in summer, and then we had our student learning centers that were open at 15 different schools. We had kindergarten through fifth grade students there, and they wear their masks every day. Our students are actually really now proficient at how to do this, and our staff and supporting our kids in doing this. But we've shown we've been able to do this and do it well. We also will offer, especially our youngest children, right, breaks outside, get some fresh air, take off your mask, be able to breathe. But kids are socially distanced in the classroom, and they have little rest breaks where they can stand up and move and shake around. But we really have proven that we've been able to do this safely and do it well, considering that we have not had one single COVID transmission from students or teachers in the classrooms during the fall opening that we've had.
Mm. And so you had this kind of, I want to say, this trial run in the fall, and now leading up to this process. First and foremost, Tina, how many students are we talking about bringing in this first phase?
So we are still getting the data from every single school. I don't have the exact number Dr. S has,
Okay.
but she can please step in and share. But every school is calling back their families and keeping a running total of who they have and making sure that the classrooms then are divided up appropriately so we have the right number of students per classroom. So we'll be able to share that back out once we know how many families are actually coming back in person for all three phases.
Absolutely. Now, can you talk to us a little bit about the PPE? Giving us some insight as to what is going to be the classroom setup, for example. Are we talking about plexiglass barriers? Are we talking about, desks being pushed apart, to stay socially distanced? Give us some insight of what are parents seeing? What will students see when they get back?
First of all, I would like to invite parents to check out our website because we actually have videos that show what in-person learning will look like at other schools. We'll be doing it again in the fall in 38 schools, right? But students will be socially distanced in the classroom, spread out accordingly. Students will be wearing masks. They will have desk shields on their desks, and teachers will have masks as well. We also have protocols when students and teachers and staff walk into the building to have temperature checks, right? And COVID symptom screening and that kind of thing. And then frankly, the cleaning and disinfecting, the district office is providing every single school the right materials for cleaning and disinfecting and having those materials on site for hand washing, hand sanitizing, that kind of thing, following all the 5 key mitigation strategies that the Center for Disease Control, or CDC, has recommended for safe opening of schools. And the last but not least, it's contact tracing. So, there could be a COVID case that comes to school, meaning someone could have COVID, but what we've done really well is make sure that that doesn't transmit to other students or folks in the building, right? So we have contact tracing where we would reach out to those who have been in the space with that person, and then we shut down pods. So we make sure that if there is someone who is impacted by COVID in a pod, that pod of students and teachers shut down and quarantined for 14 days. And because of doing that in the fall so well, we have literally not had a single transmission of COVID from a student to a teacher or a student to student.
And what about the the inventory for things such as masks? Because I know we're at this phase of double masking. Are there enough masks for each of these students that are going to be coming in?
Yes, so our operations team has done an amazing job of using our additional funds that we've gotten from the federal and the state resources to provide the right PPE. So every student will be provided with 5 cloth masks that are theirs to use. They can take them home, wash them, and bring them back. And we have all of the materials, like I said, purchased centrally for all of our schools so that they have that material. We know what the recommended materials are. They have the right ones, and we'll monitor the supply and keep replenished as we go on through the semester.
I want to now bring in the CEO of schools, Dr. Sonja Santelises. Doc, thank you again so much for being with us to have this conversation. The big story that has come out just over the past few hours has been the fact that it's been announced that the Baltimore City Public School System will be doing COVID testing for students and staff. Talk to us a little bit about this process and how often can students and staff be tested for COVID-19?
Yes, no, Faraji, we're really excited about this. We actually think this is going to be yet another layer of protection for our family, our students, and our staff. So what this next round of testing is really testing of students and staff who do not have any symptoms. So we've already had what we call symptomatic testing, meaning if you have symptoms that make you think you have COVID, we have a van, it goes, you can make sure that you get tested. University of Maryland has really been a great partner in that. This next phase is a regular weekly testing. We call it pool testing at the elementary level. And I was at William Paca Elementary School today, and I got a chance to actually practice the testing. And so what you do, and I actually had some kindergarten students kind of mentor me in this. What you do is you take a swab, take it out, you quickly put it in each nostril 4 times. It tickles. I mean, I have to say, having done it myself, it's like a little tickle. There was a fabulous teacher at William Paca. What they do, you take out the swab and then you go over, and small children can do this. You go over to one collection vial and you put the swab down. Again, because this was a kindergarten teacher, I was laughing. You put it boogers down, is what they say.
Wow, okay.
Yeah, a lot of boogers language, today, Faraji. It was, you know,
Okay.
I was a middle school teacher, so, you know, I was kind of like, okay, we're going there. And then you put them in the vial. The kids go back, they get hand sanitizer, and then they move on. And then that pool, that little test, that tube is taken. We have a fabulous partnership with 2 testing companies who are working with us, a consortium out of DC, and then Ginkgo testing. And literally State Superintendent Salmon was with me today, President Brown from the BTU. They all did the swab, you put it in there, and then you get the test back. I don't know if Chief Perkins Cohen probably isn't here, but I think it's within like a day or 2, we know if there's any COVID in that class, in that pod. And what that enables us to do is to identify any COVID that doesn't show symptoms, right? And so that allows us to kind of get ahead of it. At the high school level, because our high school students are older, we have saliva testing. And that looks like a tube. Student comes in once a week, very similar protocol, except you spit in the tube. That tube goes off to a lab and comes back, and then that student and that student's family or that staff member will know that they have tested either positive or negative for COVID. And what this is really exciting is that it allows us to get ahead of COVID that might not yet be showing any symptoms. It's not the only mitigation. Everything else that Tina just described, that Chief Hike-Hubbard just described, is in place, but this is something that will allow us to get ahead. It'll allow us to see some of the new strains that that are forming, and you know, will hopefully, particularly at the high school level, help us get more kids, more students back, given that we have that testing. So it is exciting. I did it today, quick and easy. Once the routines, it did not take more than, I'd say 5 to 7 minutes. And when, you know, if I weren't there slowing them down, they would have gotten through it a lot. But they had to tutor me. I slowed up the process, Faraji. So.
Folks, if you just tuning into our special conversation about the reopening of schools, you just heard Dr. Sonja Santelises, the CEO of Baltimore City Public Schools. We're also joined by Mrs. Tina Hike-Hubbard, who serves as the Director of Engagement and Enrollment for Baltimore City Schools. I'm asking for the students to check in with us right now at 410-319-8888, 410-319-8888. Dr. Santelises, if somebody, you know, hearing this process, and I know that this is, you said that small children can do it, but they might be thinking small children are handling swabs and walking over and dealing with and you know, interacting. Is this a process that is you know, managed by an adult, or adults watching them, or you know, they might be feeling, I mean, because some people are really like nervous about this process. So what kind of assurance that that process that you just described, Dr. Santelises, is a safe one?
So what I will say is, one, we have, we're investing in staff who are actually there and are the point people for this process. So that's number one. Number two, like really gifted teachers. Like today, I mean, Faraji, it was just as if this was the same protocol to go to the bathroom or the same protocol to sharpen your pencil. And the teacher there very gently was like, oh, okay, Sonja, remember to put your mask back on your nose because you finished. And that's right, not your turn yet. Wait at your desk. There was not, you know, kind of mad mayhem. It really became part of the flow of the system. I will say at the upper grade levels, we're working with a consortium out of Washington, D.C. that actually was founded at the collegiate level. So a lot of what, you know, and I only say that not because I don't have college students that I love dearly, but one of the things that we're seeing is that this process, once it becomes part of the routine, really is just like any other routine in a school, any other routine that a teacher manages. And the teachers today, they weren't flustered, they weren't worried, they knew what they were doing. And again, once kids get the direction, they know they don't charge to, you know, the tube, they go one by one. They know what to do with the swab. If for some reason, you know, they use there was one little boy who touched the end of the swab, which means that you can't use it. And so the teachers very gently said, oh, go ahead, put this one in the trash, sanitize, let's try again. He tried again and it was fine. So it's scary, I think, Faraji, because it's unknown. But one of the things that, you know, we're seeing in some of the videos we have in visiting today, it really can become part of the classroom routine.
And what has been the response from the parents?
Well, it's really interesting. So in these, in our test sites, we'll be rolling them out, as you heard, you know, yesterday. We have some parents who have kind of waited to see what it's like. So we had one young student today, a little girl who was all set to do it, but her parents hadn't, you know, hadn't signed the release form yet. And so she couldn't. And, you know, the person who was administrating, she said, what do you mean I can't do it? I want to get a swab, right? She wanted her own swab. So families have the opportunity to learn, to see what's going on. The videos help when they realize it's not some invasive procedure. One of the pre-K teachers I spoke with said to me, I've been tested at M&T Bank and this is so much milder than that COVID test. A lot of what we're finding is the more families see and know, the more that the process is not in some dark shadow, but they know what's happening, the more comfortable they feel. But it's still up to families.
And that's the other thing, Doctor, because I think that a lot of people, and I've heard it here on this platform, that some people are saying, I still haven't gotten tested. I mean, I'm not even talking vaccinated. I'm saying simply tested. And we had a conversation just a couple of days ago where callers were saying, look, haven't been tested. What do you say to those parents and to those caretakers of the children who have not gotten tested, who don't believe that they should be tested because they're quote unquote feeling fine? How do you communicate that? And Tina, I want to bring your thoughts on that as well. How do you communicate the importance of that process if the parents and adults don't believe that it's necessary?
Tina, you can feel free
Yep.
to if you want.
Happy to jump in. You know, Faraj, I appreciate you asking that question, because what we realized is we have our larger town halls, right? Where we bring lots of folks in, they can ask questions. But what we've learned is the smaller, more intimate conversations with families matter tremendously, because they have a two-way conversation where I can share, or Dr. S can share, and then we can actually respond to questions just like we're doing right now. So I will tell you, in the past 4 days, I have had an Arabic conversation, a French conversation, and in Spanish, where I have translators live, where I'm giving information about reopening, and our interpreters are telling families what I'm saying, and then they're asking their questions and feeling more comfortable. So to me, it's really about having access to information, and then families can make their choice, right? We're not requiring anybody to do anything, but it's our obligation to find spaces where families can ask questions, they can get all the information they need to really make the right decision for their family. And I'll just offer, I have a 5th grader, he's going back on March 15th, right? But that was a choice that my family was able to make because I had the right information. And we have to give all of our parents the same access to that information. So, we have it on our website, we send out emails regularly, but we're trying to also host things like this and smaller community conversations where folks can have a chance to really get their questions answered.
I think that's important that we have at least this conversation, because I want to make sure that people understand all of the dynamics at play here as we're talking about, going back. I want to take one call before we take our next pause. We got Malik, who's 16 years old, checking in. Malik has been waiting patiently. Malik, thank you so much, brother. Welcome to our special conversation. This is all about you. What's your question for Dr. Santelises?
Wait, can you hear me?
Yes, sir, Malik. Go ahead, brother.
All right. So I just want, assalamu alaikum.
Walaikum salam, Malik.
I just wanted to talk about how I feel as far as the COVID situation in school.
Sure, go ahead.
I think it's all, this is my first time being on here.
That's all right. Take your time. Take your time. We're here for you. Go ahead, brother. You all right?
Yes.
Just take your time.
And I'm hearing myself on the radio.
Okay, turn your radio down. Is your radio near you?
Yes.
All right, just turn your radio down because that creates that echo.
Yeah.
Okay.
So now that I chose not to go to school because I feel like I'm starting to get more better grades in school now that I'm not in school. Because when I was like younger in school, it wasn't as good as now. So due to the virtual learning and stuff.
Okay. So you feel like you got a little bit more of less distractions when you're at home.
Yes, that's how I feel.
Okay. And you would like to, first and foremost, what grade are you in, Malik?
I'm in the 9th grade.
Okay. Yeah. You're in the 9th grade. And you want to say what school you come from?
Delaney High School.
Delaney High School. Okay. All right. So you going back and everything. So look, let me do this. I want to make sure that we get all of your thoughts. So I'm gonna put you on hold. Okay, don't go anywhere because we got you, I got Jasmine, I got Mark. I want to make sure we put you on hold because I want to make sure you get your thoughts together, pose your questions so Dr. Santelises or Ms. Tina Hike-Hubbard can answer your questions, okay?
All right.
All right. Folks, we got to take a quick pause. When we come back, more of our special conversation, community conversation about the reopening of schools. I'm joined by Dr. Sonja Santelises, the CEO of Baltimore City Public Schools. I'm also joined by the Director of Engagement and Enrollment, Mrs. Tina Hike-Hubbard. I want you to join us, especially if you have young people in the school system in Baltimore City. This is their opportunity to pose their question, to share their thoughts and concerns. No question is a stupid question. We just want to hear directly from you. Join us in the conversation right now at 410-319-8888. And of course, stay with us. We got a lot more coming up in the next hour. We'll be right back with our special conversation.
We'll return to our community conversation after these messages.
Yep.
WEAA presents a special community conversation with host Faraji Muhammad.
And welcome back to our special community conversation here as we talk about the reopening of Baltimore City schools. I'm your host Faraji Muhammad. Thank you so much for tuning in and checking us out this evening. Tonight, we are having this special conversation with some of the key decision makers as for this big decision. We are joined by the Director of Engagement and Enrollment for Baltimore City Public Schools, Mrs. Tina Hike-Hubbard, along with a monthly guest that we normally have here on the show. She is the CEO of Baltimore City Public Schools, Dr. Sonja Santelises. Thank you so much for both of you for being on the show this evening.
It's great.
Thank you for having us.
Absolutely. Really quick, let's go back to the line because we got students now that are lined up to hear what you have to say about their questions and their concerns. Folks, this is an opportunity to talk to your children, your grandchildren, your niece, your nephew, the young people that you care for, the young people that are in your network. If they're part of the school system here in Baltimore City, give them the phone so they can call in and be a part of the conversation at 410-319-8888. All right, Malik, thank you so much for your patience, brother. What's your big question or what's your big comment that you'd like to share tonight?
Well, before I wanted to start staying home,
Yeah.
I thought to myself I wanted to go back to school because I wanted to see my friends, and I just wanted to know how it would feel like to be back at school because we haven't been at school for a while.
Right.
And, but then now I'm like, is it safe though? Because now that the corona thing is happening and it's seeming like it's growing more, I guess.
Yeah.
I'm kind of confused because I wanted to go back to school, and I thought it wasn't safe. So yeah, I'm confused.
So you're confused. And I just want to make sure I'm clear and understanding you, Malik. Are you confused about how serious this is, or are you confused about, what's going to happen when schools reopen? What's the big thing that you're confused about specifically?
I'm confused about is it safe?
Is it safe?
Is it
Understandable.
safe to go back to school?
Yeah, I appreciate that. Hey, Malik, I thank you so much. 16 years old, checking in, wanting to be a part of the conversation. So Malik, I thank you so much for bringing up that concern. Doc, simply asked.
Brother Faraji?
Yes, sir.
I know you from the mosque, and my father knows you too. I just wanted to say that. My father's brother Thomas.
Well, I appreciate that. Please give my love and peace and blessing to your father as well. All right.
Yes, sir.
Thank you, Brother Malik. Dr. Santelises, Tina, just a simple thing. Is it really safe? Doc, what would you say to Malik and to some of the other students that may feel that way?
No, absolutely. And I think Malik captured the heart of the question in just a real straightforward manner. And what I would say to Malik, to all the young people that are listening, is that we have put measures in place. We have put things in place like masking, like making sure there's social distancing, making sure that there's soap, hand sanitizer, running water in bathrooms. That is making going back to school safe. Now, ultimately, it is a decision that families are going to have to sit down and make together, right? And we are not forcing folks to come back. What we are hearing, and I think, Malik is saying it too, is that I want to know what's in place that makes going back safe, because COVID is real, because a lot of us have been changing our behaviors. And, I heard Malik say, look, at first I didn't want to, now I've kind of gotten used to it. How do I know I can come back?
And he's gained from being at home. He said his school performance has gone up as a result of virtual learning. So now, he might be in a place that now he got to, along with the workload, Now you got to think about the safety protocols and the other, impediments to his learning process.
Well, and absolutely. And he's not alone. And we have had young people, very much like Malik, which was why it was great that he told us his story, that who are saying the same thing, that actually I'm doing better now. Again, it's why we're giving people choice. It's why students, families have a choice. What we just want folks to understand is that we have put measures in place. We have, new air purifiers in spaces where the ventilation is not great normally, because we want to make sure we're keeping young people and our staff safe. So what I would say to Malik is, we have those measures in place. We've been doing it for a while, but if you want to wait a bit, see for yourself how it looks, talk with your family, they want to see, that's okay too. That's okay.
Absolutely. Let's go back to the line. Jasmine, 18 years old. Jasmine, thank you so much for checking in for our special conversation. What's your question, your concern?
Hello, good evening, everyone.
Good evening, Jasmine.
Okay, so I have a question. Well, more than a statement, but so I heard that freshmen.
We got Jasmine on the line.
11th graders, the 11th graders and the 11th graders and the sophomores, and I'm like, well, who really needs it more? Like I heard that we were supposed to go back. Seniors are supposed to go back in April, but I'm like, that makes no sense for us to go back and then we get out in May, and then freshmen go back, but then juniors and sophomores don't. So I was sitting here thinking to myself, like, who would need most of the help? Because seniors only have a certain amount of time to be out of school. But I also have another question. So I hear that the CEO mentioned how, proper precautions will be taken when going back to school, like masks and hand sanitizers and soaps. But I would also like to know, are desks and chairs going to be wiped down in between classes? Will temperatures be taken at between class changes? I'm scared that this may be like an incubation process for COVID.
Jasmine, well, I'm sorry, Faraj.
No, go ahead. By all means, Doc, go ahead, ma'am.
No, Jasmine, I was going to say, number one, I am glad that you are on it when it comes to the safety protocols. And you mentioned safety protocols that I did not touch on. And one is the temperature checks. And yes, Jasmine, we do temperature checks every day when students come in the building. I visited 2 schools today, and it didn't matter that I was the CEO. I had to do a temperature check. So we have temperature checks. In terms of the distancing, when you walk into classrooms now, they're going to look different than when you left. There's space in between the desks. Lunch will look different. You won't have lunch in a big cafeteria with 100 other students. You'll have lunch right in a room with a much smaller group of students, socially distanced apart. So a lot of what school looked like back in March, it doesn't look like that anymore. So that's number one, that you're absolutely right. Those additional processes, those are in place because those are what keep us safe. And I think that's important for young people to know. And as you're coming in, you should see all of that. Like, you should see markers. We actually have markers on the ground that let you know what the distance is that you need to keep away from another person. We have desk shields so that you've got to keep distant. At the same time, the good news is some parts of school won't have changed, right? You will still be able to see, some other students. You'll still be able to interact with your teachers. It'll just be at a distance. It'll be behind masks. It'll be shields, but you will get mask breaks, time to go outside and that. So that is true. And as a senior, I will tell you, I have heard from a lot of city school seniors. We were working to get you all back sooner, but within April, what we're hoping is that in coming back in April, we can also have enough activities at school to help you get ready, to get reconnected to what life will look like and decisions that you have to make after high school. We're actually having conversations with young people. So if you want to send us your ideas around what are the kinds of things that would make you want to come back in April and reconnect, and that you would find helpful in addition to your classes. And we will be announcing when we are bringing 10th and 11th graders back too. But you're right, part of why we started with 9th graders is because, Jasmine, straightforwardly, we had a lot of 9th graders who were struggling, and we saw it in their grades. We saw it just in, their attendance and a lot of things, but we are really working hard to get seniors back so that you have some time with your, friends, with your teachers, to get advice and support about life after high school before you leave. But yes, if I had my wishes, you would have been back much sooner, but we're working real hard to make sure that we have things that make sense for seniors. So give us your ideas too.
Dr. Santelises, in regards, I'm just asking this question. I know we got a lot of calls coming in, but I'm wondering in regards to the amount of time. I know Jasmine mentioned, they're going to be leaving out in May. Has that changed? Is there going to be a change in the schedule of when school will be let out because of everything else changing? So are we talking about, normally when seniors get out at mid-May or towards the end of May, has that been pushed back? Normally when the start of the summer vacation would start, has that been pushed back? Has that changed at all?
No, those are great questions, Faraji. Those are the things that we are discussing and planning now, particularly as it pertains to seniors, for the reason that you just said, right? That we knew school would be in session through part of June anyway. Does it make sense to do that? And actually, Tina, Chief Hike-Hubbard and her team, I want students to keep their eyes open for surveys, for focus groups, where we're going to hear from young people about that. But yes, this question of time, Faraji, is a big one.
Yeah.
And
but it still hasn't been determined just yet.
It hasn't been determined. Thank you for cutting to the chase. So, but it would be good to hear. You always do that for me, Faraji. You make sure.
I know. Look. I know students are like, well, what's going to happen? Because you're talking about 3 weeks, Doc.
Yeah.
In some case, they might be 3 to 4 weeks, and they're like, man, we came back for a month.
Yeah, well, and I've been hearing it. Faraji. You're like, why am I coming back for that little bit of time? But go ahead, Tina.
Right.
I was going to say, I've been hosting a series of conversations, talks with young people, right, to get their feedback. And one of the burning questions that we have to answer for them, which we still don't, is, are we going to have graduation, right? These milestone events that our young people deserve to have, right? But so we did a virtual graduation last year, and I'm going to venture to say we're going to try our best to figure out how we can do this right for our kids. If it's socially distanced, we'll figure it out, but we got to make sure we answer those questions for our young people. And this is why we are having these forums, is to get that information back so we know what to think about, what to share right back out, and give the young folks the right information that they need.
Before we move forward, what is the best way that that students like Jasmine and Malik, who are trying to stay in tune with this process, and it sounds like Jasmine wants to be a decision maker in this process, how can they get involved before we even go to our next call?
So they can certainly go to our website, which is baltimorecityschools.org, and there's a place for them to give us feedback directly, and our communications team will take that feedback. And if I have a moment, I will find my youth engagement specialist email, Rashad Staten, and they can also email Rashad directly, and he will make sure that I get all that information. So I will get that email address to you before we end the show.
Fantastic. Thank you so much. And let's go back to the line. We got Mark on the line. Now, Mark is an educator. Mark, talk to us. What's your question?
Brother Farad, assalamu alaikum, brother.
Walaikum salam, Mark.
Always a pleasure. Dr. Santelises, it has been an honor and a pleasure to serve the children of Baltimore City for 21 years now. I was also one of your soldiers that was in the field at the learning centers, helping to make that the success that it was this past fall and went into winter. I have very mixed emotions. I've made them, known here and there amongst my inner circles as well as outer circles. Missing, like, for instance, the first day of school in September, when I was in my building, it's one of the saddest moments of my school my school career, you know, that building being so quiet and being like a ghost town, and not being able to say goodbye, farewell to my seniors last year. So that last part you just spoke about, I'm looking forward to not missing that opportunity, hoping that I'll get this time around to say, hey, farewell, and offer my words of wisdom and advice to them leaving and going into the real world. But my issue is this, my concern, not issue, is that the dynamic of the high school student, the ninth grade student, is a little bit different. We were able, younger children were a bit more, for lack of the right phrase now, controllable. It was a little bit easier, like you said, to do corrective behavior. But we do understand that ninth grade dynamic is a bit different, which happens to be the very grade that I work with in the school that I am at, is quite a bit different. And I'm just concerned about some of the, unfortunately, lack of discipline issues, and when things, to use the terms of the children, jump off, and how are we going to handle those things? Because my nature, as what I do, and I'm not a teacher at all. I'm a support staff member. My nature in this business that I do is to try to de-escalate by putting myself in the middle. And I'm concerned that that's my natural instinct. And how are we going to take care of these kind of things?
Mark, I appreciate you for checking in, and I appreciate that, brother. Doc, how can we address that? How will that be addressed?
No, and that's true. And first, let me just say, Mark, thank you so much for your service, because you were out in schools early, and you are part of the reason why we're able to do this safely now, because you were out early supporting those student learning centers. And no, this is a question, Mark, that I get a lot, and Faraji. What I would say is this, that one, we do have some high school students who are returning now, right? So some of our CTE students were prioritized to come back early. We have had some of our students at alternative settings who we prioritized to come back early. So it's not as if we have not had any high school students back over the last 6 months. We have. I think so that I just want to put out there. I know Mark's SLC didn't, but we have actually had high schools, that have, Vivian T has been open, right? Renaissance has been open. So we've had high schools where young people have been returning. I think what we have found, to Mark's point, is that the attention to orienting, to making sure that young people's full needs are being met when they return, because a lot of young people have been under as much stress, if not more, than some adults have. And so when we actually put things in place to help orient them back into, this is what it means to be back in community. It's not just about come on back and let's open the book and that's all we talk about. Our team has done, and you had Ketia on earlier, that team has done a lot of work on how do we build more of the social emotional attention into, the studies that we're returning young people to, because there's a lot of frustration. There's also a lot of mental health challenges. And so some of that adds to the environment that we're trying to, as Mark said, de-escalate. I think the other piece is that it's part of why we've done a slow walk back. It's part of why we're starting with 9th grade, right? It's part of why we started with 9th, we'll move to 12th, then we'll go to 10th through 11th, so that we can bring young people on slowly. As you said earlier, Faraji, it's not like just open the doors wide and everybody just, crashes in at the same time. That's why we're doing it slow and steady. And we still do have a, code of conduct. So that, code of conduct hasn't gone away. It's just that our focus is how are we making sure that we're giving enough space for older students, high school students to learn the new processes. And I will tell you, some of the young people I'm meeting have also said to me, I'm more appreciative of school than I was before. right there. So we have young people like Mark for whom virtual is working. We also have young people who are saying, this is just not working at all for me.
Right.
And so the frame of mind coming back into school is not one of, hey, you know, I guess I'm back in this building. It's one where they are actually coming to connect. And that is also making a difference in some of the high school students that have already started coming back.
I want to go back to the line. We have, is it Asante, who's 14 years old? Asante?
No, Asata.
Oh, Asata. I apologize, Asata. Asata,
okay.
talk to us. You're on the line with Ms. Tina and Dr. Santelises.
Okay, I actually have two questions.
Sure.
The first one, I would like to know, how are schools going to get, like, where are they going to get the funding they need for the proper safety measures to be taken? And then my second question is, if students are going back for like their emotional welfare and stuff like that, I was wondering how they would be able to properly be able to do that if they're in pods and secluded.
If they're where?
If they're in their pods and not allowed to interact.
Oh, okay, okay. So first question is about funding for personal protection equipment. And then the second question is about, you know, getting, how are students supposed to kind of adjust to the new, to this transition if they're still kind of in their pods? Is that, am I getting that right?
Yes.
Okay, hold on, because I'm gonna let Dr. Santelises respond to those questions. Thank you so much, Asata. Hold on.
No, thank you, Asata. And I will ask Chief Hike-Hubbard if she wants to jump in on the second question as well. But on the first question, the good news is, Asata, that the federal government, the national government, actually sent additional money to states that Baltimore had the chance to receive. So with that money, that's what we've used to purchase the masks. That's what we've used to purchase the additional cleaning products, to make sure there's soap and sanitizer. It's paid for a lot of the desk shields that you see, the air purifiers. So the simple answer to your question is that we had additional money from the federal government and the state government that's helped us, at least with some of the purchases that we've had to make. And then we've had to make some readjustments in our own city schools budget. You know, so some things we were going to purchase that we put off a little bit, but I would say a significant portion has come from the extra money from the federal and state government.
Fantastic. And Ms. Tina, about the making the adjustments if students are still kind of in their pods. Great question, Asada.
So, Asada, yes, absolutely. And relationships matter, right? When our students are coming back and they have been, some of them have been isolated at home, not having any social interaction with others, it is important that we give them space. So while you're not going to be in the cafeteria hanging out with your group of friends and that kind of thing, you will be in a classroom space with other students, being able to engage in learning together, being able to talk through things together, and encouraging our teachers and staff to really build a relationship with our students. Look, our ninth graders have never even been to their new schools. Think about that. This is their first year in high school. They don't even know their peers. They know them on a Zoom call. They've never seen them in person. They've never seen the teacher in person or their building in person, frankly, right? So it's an opportunity to come and build relationship with each other and be able to like know who that person is that I've been seeing on a computer screen all this time. So while it's not the same as it has been, there are lots of students who have expressed to us, they've been alone, they've been isolated, they're at home by themselves, and they need that social interaction and support and engagement. And so while you're not right next to each other, you will still have the opportunity to be in relationship and community at school.
Certainly probably through their cell phones too, Mr.
And right, and Instagram and everything else. That's right. I'm thinking academically. I'm not thinking with socially. That's right.
You're going to be texting somebody.
That's right.
But we got to take our final pause. When we come back, more conversation with Dr. Santelises, Ms. Tina Hike-Hubbard, and more of your calls. You know, we have a doc, we have, you know, a parent of a special needs student. I want to get in to make sure that we have something to say. What is the messaging? What is the process for those students who have special needs? And we have others. Folks, we want to hear from you. We want to hear from students in the school district right now at 410-319-8888, 410-319-8888, as we have this special conversation about the reopening of Baltimore City Schools. Stay tuned. We got to take a quick pause. When we come, we'll be right back to continue the discussion.
We'll return to our community conversation after these messages. WEAA presents a special community conversation with host Faraji Muhammad.
And welcome back to our special community conversation about the reopening of Baltimore City Public Schools. I'm your host, Faraji Muhammad. Thank you so much for checking me out and riding along with me this evening. I am joined by the Director of Student Engagement and Enrollment for Baltimore City Schools, Mrs. Tina Hike-Hubbard. We're also joined by the CEO of Baltimore City Public Schools, Dr. Sonja Santelises. And of course, we want to be joined by you. We want you to join us right now, 410-319-8888. We would love to hear from our students, those students who are a part of the school district, those students that have questions and concerns and just want to share their thoughts about going into this new chapter of learning. Starting on Monday, March the 1st, is the first phase of in-person instruction, starting with the small children, working our way up to our wonderful, wonderful teenagers. So we want to hear from you, 410-319-8888. I want to get Kathy in because she is the parent of a special needs student. And I do not want to have this conversation without touching on what is going to be the protocol for those students that have special needs. So Kathy, thank you so much for joining us. What's your question?
Thank you. I am a parent of a sixth grader, special needs, self-contained class student who is not learning a lot because of the way they're teaching virtually. And I'm not hearing anything about returning the special needs kids. I was hoping they might be in the first batch if the parents decided to send them because of the one-on-one and the way they need to be taught. Can you help me out with the thoughts on that?
Tina, don't hang up just yet.
Okay.
No, thank you so much for the question. And I think the real reason why your child hasn't had the opportunity yet is because, did you say he? I wasn't sure.
I'm sorry, say it again.
Well, is it a boy or girl?
A boy.
Okay.
Thank you.
Yes,
when you said that, I think the main reason that he has not been called back yet is because of the grade that he's in. And so I too have two sixth grade daughters who are very upset with me that sixth grade has not been called back yet. And so I think it's more that reason. We actually have been prioritizing students with disabilities. I was in a self-contained special education class today during a school visit. And you're right, we see, even when we look across the district and families that want to come back, we actually have fairly high numbers of students with disabilities and families with students with disabilities who want to return because their experience is very similar to what you're describing. They're telling us, many of them, not all, but many have been telling us it's just not working. So what I would say is that wait and see, because we're going to be making an announcement shortly for the return of our middle grades, and that would then include your son. in that batch. But you're absolutely right. It's why we've prioritized students with disabilities. What it sounds like is the only reason he hasn't been given that opportunity yet is just because of the grades we're starting with, but it should be coming shortly.
Well, thank you so much.
Thank you so much, Kathy, for tuning in and posing that question. Let's go to Jonathan, who is another parent. Jonathan, then we got Kendra and Diane. Jonathan, what's your question for Dr. Santelises or Tina Hike-Hubbard?
All right, well, thank you very much. I've gotten some information. I feel better than I did before I started listening to it. Because a lot of things I was hearing was they're going to have the children in the classrooms. They were going to be in the classroom. The teachers were still going to be virtual. They were going to be with teachers. Helpers were going to be in the classroom. They said the children weren't going to leave the class any other day. They wasn't going outside. They wasn't going to the cafeteria. They eat inside the classroom, and that's it. And then you have to get some special pass to go to the bathroom. That's the kind of stuff that I was hearing. I read the package that they proposed in August. It said the plexiglass. I was hearing that schools, nobody put plexiglass. You might have 1 or 2 schools that have plexiglass. I heard the teachers, I don't know if they're going to be vaccinated. Have they been vaccinated? Will they get vaccinated? But then they were like, well, we're not even going to be in the classroom. We're going to be virtual. So I just have a lot of questions, and I don't understand if they're not going to be in the classroom with the teacher, why are they in there? I mean, you got, 8-year-old. I got an 8-year-old in Baltimore City Schools. What are they sending them just for daycare? They said they got to sit there through the meetings. If the teacher's not on, they got to sit there 20 minutes, 15 minutes until they get back on. I'm just kind of confused, and I just want to know what's the purpose of going back if the teachers are not going to be in the classroom or they're not going to be really able to get that one-on-one attention. It's like a daytime daycare, what it sounds like.
That's a good point. That's an excellent point. Hey, Jonathan, I appreciate you, man, for sharing your concern. And Dr. Santelises, I kind of keep hearing a recurring thing. There's so much information that has been put out there. And Tina, when you have all this level of information, some of it is good and right, and others just, I heard, that type of information. So Doc, to Jonathan's point, what is that going to set up? What's going to look like?
No, and it's a great point. And I actually appreciate you asking, Jonathan, because it gives us a chance to actually clarify some things. So first, what we have said to schools is that in-person learning means in-person learning. It does not mean the same as, it doesn't mean students just come in, sit at a computer with the teacher necessarily at a distance. Now, we do have some teachers who will have accommodations made, and that could be the case for some teachers. But generally speaking, for particular grade levels, if a family has signed up to have their student return to school, then the principal, based on numbers, right, has assigned a teacher to that class. And we know that some families need to see what's going on, right? So that's first. It should not just be young people coming in and sitting at the computer all day. That's number one. Teachers are live, right? So when students are sitting in class, there are teachers that are live, except for teachers, again, that might have accommodations. The third piece is, and I think you said that your child was 8, students will still have recess. It'll be socially distanced recess. Matter of fact, again, I was in a school today. It was a great sunny day out. Those young people were headed outside. They were laughing, they were giggling, but they were 6 feet apart. They had masks on. Students will have mask breaks. They will still have art class. They will still have, time to move. Students were still responding to answers. What might be different is that there are many classrooms where teachers will have their students in person and they will still have some students virtual. And in that case, we have some additional support for monitoring what's going on with students that are still virtual, while we also have students still in person. So again, today I got to see a teacher who had 7 students on her screen and had another 6 students in person, right? And so she was going back and forth, but she was teaching all of them together. And so there was someone supporting. But I think the big message is bringing students back is bringing them back to be able to have, as you said, the same, interaction that looks different, but is still, in person. We're not just bringing students back to sit at computers all day.
If I could just
Yes,
quickly
Steve.
add, Dr. S, that I heard it mentioned the cafeteria, and I just want to clarify that students will be eating lunch in their classrooms, but that is because of safety reasons, right? Having a lot of students come into the cafeteria together and eat just frankly isn't safe and isn't following the CDC guidelines. So they will be eating in their desk and classroom, but then they get to go outside. An 8-year-old gets to go outside and play. I also want to just offer that if families have want more information about our reopening plans, you can go to www.baltimorecityschools.org for the reopening page. But we also have a section called Family University, where there's online courses, there's information there that will give you a whole lot of information. You can walk through it, engage the videos and whatnot to get more information about the reopening process.
And I want to just Tina, I want to get your take on this in regards to the food situation. Will food still be served in the schools? Is it going to be prepackaged food? How is that?
Absolutely. So Dr. S has been in schools more than I have. I've been at the North Avenue building, but kids will be getting breakfast and lunch delivered to classrooms. And I've seen from videos, Dr. S, if you want to chime in here on what the food actually looks like for the students.
Sure, no, and in a number of cases, our food and nutrition teams have actually still been preparing food. So in some cases, students there are meals during the day and during the week that are still warm, right? So they're still getting hot lunch and still have a combination of some prepackaged meals, but those meals, as Tina described, are delivered to the classroom because, again, for safety, that having 100 students in a large cafeteria, at least as of right now, is not the guidelines. But yes, students come in, they have a lot of the same meals. They get to eat breakfast, lunch, and in many cases, even a third meal. So
foods are not being prepared in the schools as they normally would be?
Some are.
They are. Some are, okay.
Absolutely, some are. And that's where some of the hot meals are coming from. So even in schools with a large kitchen, what has changed is not necessarily that, you only get one kind of food. What's changed is how the food is consumed, how students receive that food. And there are various ways that you can do that. But for us, what we've done is actually just deliver the food to the individual classrooms and spaces.
All right, let's go back to the line. Kendra, you've been waiting patiently and we appreciate it. You are an educator. Kendra, what's your question?
Hi, Dr. Santelises. Thank you for talking to us. So I'm an educator in city schools, and I've had a few students and parents ask me about the 70% grading or the 70% assessment grading policy, and if it's going to be adjusted for virtual learning. And I know we're about halfway through the school year, but I was just wondering if the district planned on making any adjustments to the grading policy for this year or in the future.
That's a big question, Kendra. Big question. Adjustment to the grading policy.
No, it's a great question, Kendra. And what I would tell you now is we are looking at that now. And what we're trying to do is make sure that we take the lessons we learned from the spring, which is if you take away, all of the grading, then young people said to us back in the spring, why am I doing any of this? At the same time, we've heard from teachers like yourself that 70, with a lot of what young people are going through, is really challenging. And so part of what we're working on now is how do we continue to give students credit for the work that they've done, but make adjustments to that based on what we know they've gone through. So the bottom line answer, because I know Faraji will ask me, the bottom line answer is we're working on it. We're taking feedback on it. We're going to make adjustments. Dr. Rachel Pfeiffer and her team are taking that feedback. And I would say, Kendra, if you have insight, we've received some really strong feedback from teachers about this, just really useful feedback. Want you to reach out to Dr. Pfeiffer, Rachel Pfeiffer, and her team. Will put her email in the chat as well. And that would be a way for you to give some of your insight. But we're working on it now. We don't have a final decision, but we know that it's a challenge.
Folks, if you just tuned in, we've had this special community conversation about the reopening of Baltimore City Public Schools. We have been talking to Dr. Sonja Santelises, the CEO of Public Schools, and Ms. Tina Hike-Hubbard, who serves as the Director of Enrollment and Engagement. We want to continue to take calls from students because we want to make sure that their thoughts and their concerns and really their interests are being heard loud and clear. You can give us a call at 410-319-8888. Dr. Santelises, Angelique checked in on our Facebook page and said, if the target population is a student experiencing learning loss and or a heightened need for mental health services, then what is being done to appeal specifically to those students' families?
That's another great question. I think part of what we've done early on since the summer, since the fall, has been to really say those families were some of the first ones that we welcomed back, right? So those were the families that we prioritize, those exact target groups. I think now that we are opening more broadly, one of the things that we're doing is we're working with our school leaders. And of course there's variability, but we're working with our school leaders to say, you know, which families need an extra touch. And Tina can also talk about this, but knowing that, yes, there's broad messaging, but there's some messaging that actually is a phone call. And I was with a couple of principals today, Principal Hardy at William Paca, and she and her assistant principal are taking calls from families directly, you know, unfortunately for them, you know, late into the night, because one of the things they said to me is that there's some folks who aren't going to read through a long Q&A. There are some people that just aren't, you know, they're not going to connect on the website. And so what we're encouraging our school leaders and our teams to do is to actually reach out to those families, prioritize direct outreach to those families who you know have additional challenges. Some of that has been home visits. So some of our alternative schools, I was at North Ave today, and a young man, young 17-year-old, you know, said hello to me sheepishly. And I said, hey, how are you? And he said, well, I'm back, Doc. And that was because one of our staff actually went out and found him, right? So part of what we're trying to do is do that direct personal touch to those families who we know really have students in those priority groups. But it's a great question. It's a great question.
And I would also encourage families to reach out to your home school, right? If you feel like you have questions, concerns, call your home school. Like I said just today, I did a whole session in Arabic. I don't speak Arabic, but I did it in English. It was all translated, right? And interpreted. And the parents have legitimate concerns about transportation, about class size. And, you know, we can talk in generalities about what a school classroom is going to look like with a number of students. But when you call your home school, your community school coordinator, your principal, or someone you have a relationship with in the building, they can actually give you more information about what's happening on the school site. I'm going to put a shameless plug out there as well. We have a family survey that's out right now. We want to learn more about families' experience. We did one for the beginning of the year. We have one out right now on our website. Families, please, we want to know what your experience has been with virtual learning. We want to know what your thoughts are about how your child is doing, how your school is connecting with you, so that we can actually know where to provide support and coaching to our schools once we hear back from our families. So I'm going to encourage, and our young people, frankly, we have a youth survey out as well about young people's experience. And I think we have right now about 3,000 responses. I'd love to have 5,000 more. I want to hear from our young people so that weighs into how we make our decisions moving forward.
And I appreciate that, Tina. We got another Facebook question from Ketia. Ketia asks, what about schools with trailers and no running water or bathrooms? What are those students supposed to do?
So what I would say to Ketia on that is we know that there needs to be running water, right? So running water and bathrooms are part of what needs to be in place anyway. So while there might be, and I'm not sure of the context that Ketia's describing, but we would normally need to have a plan if something is off with that particular portable or that section, that those young people would always need to have access to facilities, right? And so that does not change in in our current state. What it might mean is that one, there are more actual hand washing breaks, right? So if we know that, prior to COVID, well, I'd wash my hands maybe, maybe not. Now it might mean that we have to incorporate a more deliberate place in the schedule for hand washing. And what a big change students and families will see in schools is that there are hand sanitizing stations that previously did not exist before we had the COVID. So between the hand sanitizing stations, increased bathroom breaks, and making sure there's soap in bathrooms and that there's running water, that actually would be how we would address that.
Absolutely. Diane, thank you so much for checking in and for your patience. What's your question?
Good evening, Faraji, and good evening to your guests.
Good
This
evening.
is my first time calling in.
Oh, fantastic. Welcome.
I am a retired educator, and I have a couple of questions for Dr. Santelises, if I may. One question is, who will monitor the children while they are having lunch? Is this the responsibility of the teacher? And who will sanitize the desk and chairs that are in the classroom at the end of the day? Will this be the responsibility of the teacher? And my third question is, I am concerned about the emotional support of teachers. I have friends who are very scared and almost petrified about returning to school. So what type of support will they get? And these questions I would like for Dr. Santelises to answer, please. Thank you.
Fantastic. Thank you, Diane.
No, thank you, Diane. And if I forget a couple along the way, I'm sure Faraji and Tina will help me out. No, just because my memory.
I took them down. I took notes.
I got notes too. Go ahead.
Awesome. Well, you guys are the diligent students.
Mhm.
So first, Diane, let me start with your last question first. One of the things that we know is that this is scary for everyone, and it is particularly scary for teachers. And one of the things that we've worked really hard to do, particularly the last few weeks, is to acknowledge that and to say, we know that we've been addressing social emotional learning for students, but how do we do a more deliberate job in supporting social emotional learning for adults? So for instance, yesterday we had full day of professional development for teachers that would be returning. And most of that day was spent on really that social emotional needs for adults, right? So, you can't have healthy students and have adults that are gripped, with fear and their own anxiety. So that's one. Two, what we found is that when teachers hear from other teachers who have been actually in person, it means more than, frankly, even hearing from me, right? So when they get a chance to hear from, and we had over 2,100 teachers participate yesterday. And one of the things that was true was that they got to hear from their own colleagues. So their own colleagues said, could answer questions like, what happens if a student doesn't want to put their mask on? Or what happens if, you're not sure where your desks are supposed to be so that they're 6 feet apart? Those kinds of things were carried differently from teachers. And then finally, I'd say on that is, we have a teacher advisory council. And one of the things we announced yesterday is that we're going to have a teacher social emotional, a teacher's SEL group that's really going to focus in on what are the kinds of supports that teachers know that other teachers need, so that we can put more things in place besides, the counseling and other things we've always had, but really hear from teachers around that and teacher leadership. So that's my answer to that question. What were some of the other?
The other two pieces are, the monitoring the lunches while the students are eating, who's responsible for that, and then sanitizing the spaces. And I think that we talked about sanitizing the spaces, that's going to be done. when one of our students asked that. And then monitoring the lunches who is responsible? Are the teachers responsible? Will there be a student aide, a teacher's aide coming in? And at that time, who is responsible for that, Tina?
So it really is a combination based on the school schedule. So we gave schools some flexibility around how they would do that. We have standard operating procedures that whoever is supervising the lunch. And very often in the schools I've been in, it actually is the classroom teacher, right? So, and there are protocols, right? So when, you know, young people are eating, they have to stay within their 6-foot box. It means teachers have on masks and face shields during that time. And then the cleanup process is one that follows, as Faraji referenced earlier, kind of a regular cleaning schedule that we now put in place as part of the safety protocols. So in a large number of cases, it is a classroom teacher. In other cases, it is either an aide or another staff person. But what is clear and consistent is what the standard operating procedures are for eating. And that's kind of laid out clearly in our safety plan.
And the final big question is for the night, if there is an outbreak, if a student is found coughing or sneezing, but more importantly, if there is an outbreak, is there a mandated policy on how the school should operate, or is that going to be based upon the school's governance, each school's governance?
No, that is not made up by each school. That is part of, again, standard operating procedures. We have had instances through the fall where we would either have someone who was displaying COVID-like symptoms, and so that would require testing. That's why with the University of Maryland, we have the van that can come and actually do the testing. We follow protocols. It's why we keep students in small groups. So if we find, for example, that there is someone in what we call the pod or the small group that has tested COVID positive, then we follow the procedure, which is everyone in that pod quarantines for 14 days. And we provide everyone in that pod with the opportunity to be tested, right? So that we have both. But that 14-day quarantine, these are some of the same practices that we've actually been doing throughout the year. The other piece is if a student is found to be positive while they are in school, then that student goes to the health suite and waits there for their parent or family member or guardian to pick them up, right? So we don't just kind of let them flow through the day. If that test result would come back, or if they're displaying those symptoms, we would remove them from that pod, from that small group, and they would then go to the health suite and wait there for a family member or guardian to pick them up.
Fantastic. I know we have a couple of moments left, and I truly appreciate all of you for being a part of the conversation. Tina, for those who could not get their questions answered, or for those who could not do anything, try to get that information out to us tonight, what's the best course of action for them to take? So
we got a couple options. For our youth, I want you to email our youth engagement specialist, Rashad Staten, and his email address is rdstaton, and then the bcps.k12.md.us. Dr. S mentioned Rachel Pfeiffer, who's our College of Career Readiness Executive Director. Her email address is rypfeifer@bcps.k12.md.us. Now, general questions, you can always email the communications inbox, and that is communications@bcps.k12.md.us. Those are general questions, and we will be certain that we answer every single one of them, because this is critical. We want to make sure we get the right information out so folks can make the right choices for themselves and their families.
Tina Hike-Hubbard, I want to thank you so much for your time. Dr. Sonja Santelises, thank you so much for choosing us to have this important conversation. We truly, truly appreciate it. We also want to give a big thank you to Dr. Tolu Onigbanjo, and Ketia Stokes. We thank you so much. Dr. Santelises, again, we look forward to chatting with you next month to give us the latest on this this big decision. But we, again, thank you so much for your time with us tonight.
No, thank you, Faraji. And thanks to all the young people and families who called in. Your questions really help us not only get better, but get the word out. So really thank you for engaging. And Faraji, thanks for giving us the space to be able to hear from our city's young people.
Absolutely. I want to thank our digital and communications team at the Baltimore City Public School System. We want to thank our WEAA team, my man Andre Melton, my producer Demi Goff, my chief engineer Mike Middleton, and our digital manager Makari Kemp. Thank you. And of course, our executive producer Mallory Pinkert-Pierre. Folks, stay tuned. Up next is Lola Within the Groove. As always, never be afraid to challenge what's wrong. Stand for what's right while being yourself in the process. I look forward to having another great conversation with you tomorrow on For the Culture on WEAA. Thank you for tuning in to our special community conversation. Have a great evening.